What are the signs of hypoglycemia? Hypoglycemia is a condition that means actually too less glucose in the blood, and it affects people who have diagnosis with diabetes and who are taking certain treatment against diabetes. And the most famous ones that can cause this hypoglycemia is insulin. So it has different phases, and if it's a bit extreme, this hypoglycemia can actually be considered a medical emergency, and it can be life-threatening if it's not treated right away. So first, what are the signs? Like, how can the person notice if he has hypoglycemia, he or she? First, the skin can look pale, the face is looking pale, not the normal color. A bit an anxiety or difficulty concentrating. The heart can be like rapid heartbeat, it's beating faster than normal. Hunger and sweating, also shaking the hands, and this feeling that the person is really uncomfortable. If the hypoglycemia is a bit too extreme, it can actually cause like a blurred speech. The person cannot speak normally, loss of coordination, also when driving a car, and very hard difficulty to perform any normal tasks that the person was performing. This is like the middle hard hypoglycemia. And if it's too extreme, it can actually lead to loss of consciousness and seizures. And in these two severe symptoms, if there's loss of consciousness or seizures, it is considered a medical emergency. The person has or someone else has to call the ambulance right away to treat this person. And what can the person do if he has this hypoglycemic symptoms? First thing you can try to do is to always keep with you 4 pieces of sugar, a sugary drink like orange juice or something that has high amount of sugar. Also fizzy drinks like Coca-Cola, Sprite, but the one with sugar and not the zero version of them. Or also grape sugar like cubes, you can have them with you. And the idea is to actually take something that is rapidly absorbed in your bloodstream to increase rapidly the sugar concentration and then reverse the symptoms of this hypoglycemia. Because if too less glucose is in blood, the idea is to actually give too fast glucose to increase the glucose level, and then the body can normally function, because glucose is a very important substance for the blood and the organ. Like, it has to be in a certain level in the blood. Also, if it's too severe, there is an injection called glucagon. There's also on the market a new nasal spray, and this actually has the opposite effect of insulin. It causes the body to release a lot of glucose in the blood and reverse the symptoms of hypoglycemia. In certain cases, your family and friends have to be trained how to also use this injection or nasal spray so they can help you if the symptoms are too severe.